So today we're going to cover an approach to seizures in pregnancy. And it's not something typically taught, but it's something important to obviously understand because you guys will often rotate through obstetrics and gynecology or work in a district facility where you are managing patients that are pregnant. And obviously seizures are a potentially life-threatening issue, and you should have an approach to the cause of seizures. So let's discuss seizures in pregnancy. So I like to think of it firstly as the primary pregnancy-related issues, then more medical issues that pregnancy might predispose to, and then sort of other issues. So let's look at the primarily pregnancy-related issues and seizures. And obviously the first thing that comes to mind is eclampsia. And that's obviously later on in pregnancy related to blood pressure, proteinuria, etc. meet the criteria for eclampsia based on the seizures. And this gets managed primarily by the obstetrician, magnesium sulfate, managing the blood pressure, etc. So eclampsia, always think about that in a pregnant patient and do your obstetric workup. Similar related to that there, when we think about raised blood pressure, there's the concept of a condition called PRES, P-R-E-S, posterior reversible encephalopathy syndrome. And this often presents with seizures as well. And that's typically in the presence of raised blood pressure. Next is what can pregnancy sort of lead to, like normal medical conditions. And we can just think of epilepsy in general. Pregnancy, reduces the seizure threshold, both from a pregnancy point of view, but also from a hemodynamic issue and drug concentration. So a known epileptic, if you don't address the drug doses, they may present with breakthrough seizures in pregnancy. Next condition that we have to always be wary of is cerebrovenous sinus thromboses, or CVSTs. Pregnancy is a prothrombotic state. So typically this will be accompanied by headaches. They could even have focal neurological deficits if there's a venous stroke. And because of the raised ICP, they might have papilledema on fundoscopy. So CVST is also a strong consideration and something that we work up thoroughly with patients that are pregnant present with new onset seizures. Another thing to consider could be infections. We know that pregnancy is a immunocompromised state, so they could be predisposed to things like meningoencephalitis, etc. But obviously in the right clinical setting, features of neck stiffness, maybe reduced level of consciousness, raised inflammatory markers, we have to consider lumbar puncture in those cases. Other considerations can be pregnancy affects things like AV malformation. So you can have, because of the varying hemodynamics, you can have things like that they flare up in pregnancy. That could also irritate the cortex and also cause seizures. Certain conditions as well. Later on in pregnancy and postpartum, we have the concept of reversible cerebral vasoconstriction syndrome that could also result in seizures as a rare complication. And I'll probably put this last on the list, and I often do this for a lot of neurological conditions, and that is functional neurological disorders, in this case, pseudo seizures, or what we call psychogenic non-epileptiform seizures. It's something that we never consider first line, because that means that we're not going to treat them with medication. But it's typically in a patient that you've either witnessed an event that doesn't look like a true seizure, or the history just doesn't make sense. I mean, obviously pregnancy is a quite stressful, anxious period, so they can present with somatiform symptoms, or maybe they're just even faking it because of stress and attention, etc. But again, really at the bottom of the list, but just something to keep in our mind, back of our mind. So just to summarize, when we think about pregnancy and seizures, think of the pregnancy-related things like eclampsia, PRES in the presence of raised blood pressure. We can think about how pregnancy affects medical conditions like reducing the seizure threshold in a known epileptic, predisposing to venous sinus thromboses, resulting in maybe AV malformations flaring up, immunosuppression and the resulting or subsequent seizure infection that can cause seizures. We can think of rare things like reversible cerebral vasoconstriction syndrome. And then lastly, at the bottom of the list, we can think also of things like pseudo seizures. Working up this patient, imaging will be the most important thing. So obviously obstetrics will work up on the obstetric components, but from a neurology point of view, imaging, if we think that there's things like features of raised intracranial pressure or CVSTs, lumbar punctures if required, and an EEG as well, that would be there to confirm seizure activity. And yeah, so it's something that obviously needs a workup. We don't mind getting this consult, but obviously obstetrics need to exclude their specific causes first.